Ko, kita ba may ano?
Okay. Okay, so first, so what causes dengue?
Dengue is caused by Aedes aegypti mosquito. It's a day-biting mosquito.
Hmm. And so, like, if you get bitten, what are the symptoms that someone has dengue?
Okay, normally the patient presents with fever. That's the most important symptom. It's really just the fever. And usually no other symptoms except for a headache.
Hmm.
And then there's a general feeling of body malaise or weakness. Those are the usual symptoms of dengue. Then the fever normally lasts for about 4 or 5 days. Yeah.
And then, so if you have dengue, if you're caught having dengue, are there different stages of dengue?
There are several stages of dengue depending on how many times the dengue mosquito has affected you. So usually if it's just your first time, you usually just stay in stage 1, which is just lowering of the platelets, your WBC or your white blood cells also start to go down. But usually during the first attack, there's usually no bleeding. Then the more you have more of these attacks, that's when the patient starts actually having really severe low platelet count and the probability of bleeding that's requiring blood transfusion.
Wait, do you think you can describe each stage of dengue? Like what happens to the patient?
Okay, first the patient normally presents with high fever. Okay, fever that doesn't seem to go away. Okay, and then usually what we do is that on the 4th day of the fever, there are now several tests that can be taken. In fact, usually even on the 1st day of the fever, you can take a test. It's very, very new. It's called the NS1. But it really just diagnoses one type or one strain of the dengue. There are actually 4 strains of the dengue. So it doesn't mean that if you test negative with the NS1, that means you're free of dengue, because there still are 3 types. Then on the 4th day of the fever, assuming you reach the 4th day of the fever, you can start taking your CBC or your complete blood count with platelet count. Then you have other tests like your dengue blood test that you can check for the IgG or the IgM of that, just to see if you're having an active infection of the dengue or if you've had the past infection of the dengue or if there's any relation to your current illness. Yeah. So if let's say on the 4th day of life, it's still a question, then you can take another test on the 5th day of life. But generally, you will notice that the platelet count really drops significantly when the fever disappears. So unless you've had the infection before, then if you take the blood test early, you'll see that the platelet count and even the WBC count is going down slowly. But then if it's let's say your first attack, you might not see that trend as much as compared to when the fever totally disappears. So if it's your first, the stage 1 is just that. Stage 2 will be a little, that's when your platelets start going down, your PTT or your prothrombin time, your partial thromboplastin time, your WBC, everything starts to go down, and then there's a big discrepancy between the control and the patients, and it's a little too technical, I think, for your class, but when those parameters start to go haywire, then you know you're entering already that stage. And then of course you have the bleeding stage after that, and then finally the shock stage.